Hello, and welcome back to Dr. Lawyer Official, your go-to channel for medico-legal insights. Today we're exploring the psychiatric certification process for mental insanity in India. With the Mental Health Care Act, 2017 and subsequent amendments, the process has become more structured, ensuring patient rights and legal compliance. Let's break this down step by step. The first phase is all about ensuring the right credentials and documentation are in place. First, verify professional credentials. Make sure your registration with the State Medical Council is valid. Maintain updated psychiatric certification and institutional affiliations. Next, collect required documents. This includes the patient's government-issued photo ID, address proof, and previous medical records. If court-mandated, ensure you have the necessary legal orders. Then, conduct a preliminary examination. Record the patient's biographical data, family history, and current complaints. Perform a mandatory physical examination to rule out medical causes for symptoms. Next, we move to a comprehensive mental state examination, which is critical for accurate diagnosis. First, assess the patient's consciousness and orientation, time, place, person, and situation. Then, evaluate cognitive functions like memory, attention, and abstract thinking. Check for perceptual issues such as hallucinations or illusions. Analyze thought processes for content and coherence. Understand their mood and effect. Look at emotional states and appropriateness of responses. Don't forget a risk assessment to evaluate suicide risk, danger to others, and self-care abilities. This step determines if immediate intervention is needed. Diagnostic procedures are the next step. These include basic laboratory tests, complete blood count, thyroid function, liver and kidney function tests, and drug screening. For advanced tests, use MRI or CT scans, EEG, or psychological testing if required. Finally, follow the ICD-11 or DSM-5 criteria for diagnostic formulation. Document every step meticulously, including differential diagnoses and severity assessments. Now comes the actual certification. Use official letterhead with your registration number, institutional details, and the date of examination. Include detailed clinical findings, specific diagnoses, and a functional impact assessment. Attach supporting documents like test results, previous medical records, and witness statements if applicable. Legal compliance is critical here. Ensure your signature, official seal, and page numbering. A second psychiatrist's opinion if required. Secure storage of documentation with digital backups. The certification doesn't end at issuance. It requires regular follow-ups. Schedule periodic assessments to monitor progress, treatment response, and functional improvement. For certificates with a validity period, ensure timely renewal with updated assessments. Let's discuss the legal requirements as outlined by the Mental Health Care Act, 2017. Minimum of 2 psychiatric opinions for certification. A clear appeal process for patients. Mandatory reporting obligations to local authorities. Recent amendments, 2020 to 2024, emphasize periodic updates and better documentation standards. The psychiatric certification process is a delicate balance of clinical expertise and legal compliance. By following these steps, you can ensure accurate diagnoses while protecting patient rights and adhering to the law. If you found this video helpful, don't forget to like, share, and subscribe to Dr. Lawyer Official.